There is just 1 week left of early voting ahead of the November 4th election day. There are 17 statewide propositions on the ballot. Prop 14 would allow the state to spend billions of dollars to create the Dementia Prevention and Research Institute of Texas. Jason Wheeler spoke to an Austin woman about the importance of this proposition.
Money cannot cure every problem, but it is key to curing this one. To someday undo the menace that is Alzheimer's disease and perhaps even prevent it will take a tremendous financial outlay, and you have the chance to decide whether this state should make a Texas-sized commitment to that priority at a scale unheard of in any other state.
I mean, this is truly unique. Texas is in a unique position with both surplus but also leadership.
That's Dr. Joanne Pike, the president and CEO of the National Alzheimer's Association. She is also an Austin resident and is imploring her fellow Texans to vote yes on Proposition 14 in the November 4th election. Early voting for that is already underway. The legislature already passed this, but voters have to sign off on spending $3 billion from our budget surplus to create the Dementia Prevention and Research Institute of Texas. That Texas commitment would be close to the $3.8 billion budgeted by the federal government for Alzheimer's research last year. Now, out of the Texas fund, up to $300 million each year would be spent to fund Alzheimer's and dementia research and programs in Texas. Some perspective about that $300 million a year that the state could be handing out in grants.
The Alzheimer's Association, as an organization, we invest about $112 million annually within research. DPRIT would triple the amount the Alzheimer's Association invests immediately.
Dr. Pike predicts that this would draw top Alzheimer's researchers and medical companies to this state, and that it would create better testing systems and more clinical trials here in Texas, and that it would speed up and improve care for more than 460,000 Texans living with Alzheimer's and their 1.1 million unpaid caregivers here. And she says the timing of all of this is especially important. One public policy group estimates that Texans 65 or older will be the fastest growing age group between now and 2050, expanding by 88%.
So as we see our own state age into the greatest risk factor for Alzheimer's and other forms of dementia, that cost to us and our Medicaid program is only going to increase.
Much more from Dr. Pike, including how close she thinks we are to huge breakthroughs and how this Texas Dementia and Alzheimer's Research Initiative could be key to making those advancements. It's all in our Yolitics Political Podcast conversation with her. I have a link to it in my article today posted on my socials, or you can get it wherever you get your podcasts. And remember, these constitutional amendment elections determine how huge sums of our money get spent, and they usually have notoriously low turnouts. So by voting, you're also doing your part to make sure that we're all right on the money.